So hopefully you're able to better understand the differences between breast milk and formula. There's another slide here where it says formula, and there are a couple bullet points on telling you what the difference is. So again, this is going to help you reiterate what we have already discussed, maybe in a little bit more detail. Now let's talk about volume for young infants. If you look at this nice table, table 8.5, you can see that from birth to 1 month, they're going to be drinking about 16 to 20 fluid ounces per day. They're going to require about 8 to 12 feedings because their tummies can only hold about 1 to 2 fluid ounces. Then at 1 to 2 months, and keep going down, I'm not going to read this whole graph to you, but you can see that the volume size increases. And this is because their tummies get bigger, so as their volume size increases, then the number of feedings is going to decrease. So when we look at formula prep, a lot of people end up getting this wrong. There are a couple different types. So there's a liquid concentrate where you're going to be adding some sort of water to it. There's one that's ready to feed, and then there's also a powder where you're going to mix. Now, a couple of problems with the liquid concentrate and the powders is they can become too diluted. Therefore, baby is not going to be getting as many nutrients as they require or what the serving size actually should be. Or it can be on the opposite side to where it's too concentrated and they're not getting enough of that water mixed into it. So as we've been talking about, it's ideal for infant feeding to have breastfed for the first 12 months of their life. No other liquids or food is necessary until about 4 to 6 months. Now, determining whether you should introduce food at 4 months versus 6 months, you need to watch baby. Is the baby able to sit upright, hold their head, and do they kind of search and open their mouth for a spoon? That's kind of all signals to show that they're ready, as well as moving their tongue from side to side. And as we've already talked about, cow's milk should not be introduced until after 1 year of age. So why are solid foods not necessary before 4 to 6 months? It's interesting to look because the breast milk and formula are nutritionally complete foods for this infant during this time. The macronutrients are properly balanced, so as you know, the protein is not necessarily the most important, but that fat content is crucial. Early introduction of solid foods can increase the chances of developing allergies. This also increases their sodium intake, which can potentially put them at risk for hypertension later on in life. That HTN stands for hypertension. Hypertension is just a fancy word for high blood pressure. Another study that they're looking at is early introduction of solid foods can lead to becoming overweight or obese for that child. Solid foods interfere with iron absorption in breast milk, and they do not help the baby sleep through the night. So this is why it's crucial that we wait until they're 4 to 6 months of age to introduce solid foods. So how do you introduce first foods to the infant? What should the sequence be? Sequence of introducing food should start with a single grain cereal. You don't want to do a multiple grain cereal because there's potential, if it's a blend, let's say with rice, barley, and oat, and the infant is allergic to oat, how do you know that it's oat and not rice and barley? So introducing one food at a time and giving it about 2 to 3 days because you may not see symptoms, or also you can determine, okay, it was indeed the oat. This is important when introducing food. You must wait 2 to 3 days in order to offer a new food to determine food allergies. Rice cereal is usually one of the better cereals because it's the least hypoallergenic. It's a good source of iron and zinc for 6 months because around this age is when their iron becomes very important for a baby. We always want to introduce pureed vegetables before fruit. Now the reason this is because if we introduce fruit first, it's sweeter, so then baby is probably going to deny vegetables. Because they have not developed this palate for sweet food, introducing vegetables first is very important. So you can have pureed green beans, peas, carrots, sweet potatoes, but again, you don't want to blend them. You want to have a single green bean, a single pea, a single sweet potato so you can determine food allergies. Then we can introduce pureed fruit. So as you can see, the next slide, the sequence of introducing foods, you can see which food should be introduced around 6 months and which should be introduced after 1 year. So the whole egg as well as milk and then citrus juices should not be introduced until after 1 whole year. Now around 6 to 8 months is when we can start introducing a little bit thicker texture, so things like cottage cheese and yogurt, and also around 6 to 8 months is when they can start using a sippy cup. In general, the rule of thumb is 4 to 6 months that it should be a soupy texture, no lumps. Around 6 to 8 months is when they can have that softer texture and lumps are okay. The serving size is to begin with 1 to 2 tablespoons per meal, 1 to 2 times a day. This will help baby adjust to having food first. So go to the slide where it has the baby picture and it says, what is going right here? So take a moment to think about what's going on in this picture to make this right. Do you got it? So one of the things is baby has mouth open, her eyes are engaged, and she is ready to take that spoon in her mouth. This means that she's ready for feeding. So how do we know when enough is enough? This is extremely important because what we're doing is we're developing this baby's hunger signals and full signals. So one of the things that most of us probably grew up with our parents saying, you don't get to leave the dinner table until all your food is gone. Now this is not a proper way to teach our children to eat because this leads to overconsumption chronically, therefore we have an obesity problem. We really need to be in tune with our hunger signals and our full signals, so that way we can cut ourselves off before we're stuffed with too many calories. So we need to watch for the baby to turn away their head. If they start to slow down, if they start to play with their food, if they keep their mouth closed, they have the most amazing instincts to know when they're full. And we do not want to mess up their cue because then they're going to not know when they're full. And we want them to keep those hunger full signals. So some inappropriate foods are any type of choking hazards. So things that could easily get stuck in their windpipe. So such as popcorn, peanuts, nuts, grapes, whole grapes, hard candies, jelly beans, anything round that could be and hard that could be easily swallowed. Anything that's really sticky to the mouth as well, like peanut butter or crumbly chips, are inappropriate for infants. So what kind of supplements does an infant need? Fluoride, if water is treated, if water is not treated, a fluoride supplement will be needed. Iron at 1 milligram per kilogram per day after 4 months. A B12 if mom is vegan. Vitamin D at 400 international units, only if they are exclusively breastfed. So why this is that formulas are going to be fortified. Infants who were born with a low birth weight may need additional supplements, so this is going to have to come from a physician. Liquid multivitamins is a common way of giving this baby these supplements. So some warning signs of growth difficulties is going to be a lack of height or weight gain. So going back to those growth charts, if we see them drop instead of having a linear climb, then we know something is not correct. They could potentially plateau with their weight, length, or head circumference around 1 month of age, but this is okay, this is normal, so we're going to track it. And if it continues to plummet, then that's when it's an issue. So what are some common nutritional problems related to infants? FTT, or failure to thrive, is a primary one, where there's a caloric deficiency. We need to increase their calories, and protein is usually the first step to help combat this failure to thrive. The registered dietitian is going to assess the growth and the nutritional adequacy and establish some type of care plan and provide follow-up to make sure that this baby can properly develop. Colic is a typical one as well, where the baby is very irritable, fussy, and crying. We may need to change their formula because maybe they're allergic or something is just causing their tummies to be upset within that formula, or maybe even the breast milk. Iron deficiency is another one, so this is why it's important to start supplementation and have iron fortified cereals around 4 to 6 months. Constipation and diarrhea, increase fluids, and watch iron supplements. These can both cause constipation, and the fluids, increased fluids would be a diarrhea. We need to be careful. If the baby is having chronic diarrhea, they are going to be dehydrated, and babies can actually die from this dehydration. So it's important that we watch that hydration. Food allergies and intolerances, we want to watch any type of sign where maybe their throat starts to close up or skin reactions. Some of the most common food allergies include wheat, milk, eggs, peanut butter, shellfish, citrus, and tomatoes. So we really need to watch when we introduce these foods to the baby. Now let's talk about baby bottle caries. This is just a fancy word for dental cavities. It's one of the leading causes of chronic diseases for babies and infants and children. It's found in children over 1 year, but can initiate during infancy. Lying down with a bottle containing carbohydrates can increase that risk because that sugar is just going to sit on their teeth. If they fall asleep with any type of liquid pools in their mouth, this bacteria can feed off of it and cause tooth decay. It can also lead to some type of ear infection since liquid does not fully drain from ear tubes. So we don't want the baby to have a bottle in bed laying down. Now you can look at this nice little graphic of the baby bottle tooth decay and an advanced development. Not a pretty sight. To prevent this, we want to limit the use of bottle during bedtime. Offer only juice in cups, and we don't want to give them juice right before they go to bed. If the bottle offered for sleep, use water instead of the formula or milk, because that carbohydrate is just going to sit on the teeth and basically rot it out. Infants at risk. Energy needs increase with an infection, fever, trouble breathing, or any recovery from surgery. So if an infant had to have maybe an open heart surgery, they're going to require more calories to help heal that surgical wound. Fevers also increase how much you burn calories. Even for you and I as adults, as we have a fever, we burn more calories. Energy needs will decrease for infants who have Down syndrome, smaller muscles, or in any type of inability to move their muscles because they are less active. So this concludes the lecture on infants, and we're going to cover daycare infants next. So please continue on with the next lecture.